Good day and hello everyone. My name is Tasya and I'm from group 26. So this time I'll be talking about filling and checking preoperative chart.
So, what is preoperative checklist? It is a checklist that is required to be asked and assessed as a part of the patient's safe care before going for surgery. The goals of preoperative checklist or assessment. So the first goal is to reduce any risks which can associate with the surgery and anesthesia. And then to increase the quality, thus decreasing the cost of the preoperative care. So how is it done is because when we can reduce the risks which are associated with the surgery, we can prevent any complication that might happen in the surgery or in any period later, like in post-operative care or etc. And then to restore the patient to the desired level of function. And then the most important thing, to obtain the patient's informed consent for anesthetic procedure. And another most important thing is to ensure that the patient is healthy enough to undergo any anesthesia and the surgery procedure later. And now we are moving on to the preoperative preparation. So here I will explain what are the compulsory things that the medical staff will do towards the patient in preoperative period. So the first one, patient identification. Here, the nurse will ask for the patient's complete name and birthday and check their identification bracelet and compare it against the patient's records. It is very important to accurately identify the complete name to prevent any potential errors. And next is medical history and physical examination. So here, the physician or the surgeon who is in charge will completely document the patient's medical history and physical examination. And usually, it was done before the day of surgery, but it can also be done on the day of the surgery. So, if the patient had any changes in their health condition after they done the medical history, it is very compulsory to inform the doctor about it. And next is the laboratory test. This include taking blood specimen and other thing. So the laboratory test, it should be based on specific clinical indicators or any risk factor that could affect the surgical management or anesthesia. This include like age, sex, pre-existing disease, and type of anesthesia or any surgical procedure. So this test, it should be completed within 24 hours before admission. So the result will be available for the doctor to review it. And next is the blood type and cross-match. So if a transfusion is anticipated, the patient's blood type is type and cross-match. And then many patients, usually we have to, they prefer to have their own blood drawn and stored for after transfusion. And next point is X-ray and ECG. So X-ray and ECG. X-ray, if you bring an X-ray film with you, then the nurse will check it if the label matches correctly with your identification. And usually, on preoperative period, X-ray is not routinely required for all patients, but it may be required by the facility policy or medically indicated as adjunct to the clinical evaluation of patients. And the most important thing is the written instruction. So the patient should receive written preoperative instruction to follow before admission for the surgical procedure. This instruction should be reviewed with the patient surgeon's office or in the preoperative testing center. Here are the example of written instruction which are going to be used by the medical staff in charge, or usually the nurse or the surgeon or the physician. They are going to fill this with a right and accurate information of the patients. And with that, I would like to end my presentation. Thank you very much for listening and watching.